And so here, scrolling down past the gastric antrum and now to the pylorus, there is this area of irregular thickening. It looks a little bit more mixed density, where there's some areas that are relatively low in attenuation and some intermediate attenuation areas. Let's see if there's any other clues. So scrolling down just a little bit more, we find this cluster of lymph nodes along the inferior aspect. So we can take a look at that on coronal. Here's the antrum into the pylorus, where that area of thickening is, and then we see those lymph nodes along the inferior aspect. So the question to ask yourself here is, do lymph nodes make you more or less concerned about cancer? In other words, would you expect to see reactive lymph nodes in the setting of gastritis? So you can remember our last case, really impressive case of gastritis, no significant surrounding lymph nodes. In this case, we're dealing with more intermediate attenuation wall thickening and adjacent lymph nodes. And indeed, this was found to be a case of pyloric adenocarcinoma. And so those lymph nodes are actually a feature that would be more suspicious for neoplasm than for inflammation.